Good morning, everyone, and thank you for joining us for Webinar Wednesdays with Senior Medicare Patrol. Our April hot topic has been genetic testing, fraud, and scams, so we're going to be discussing that today. My name is Sunny Lawless, and I am the volunteer coordinator for the SMP programs, and I will be one of your hosts this morning. Presenting today is Monique Thomas. She is our Assistant Director and Complex Interactions Specialist. We will be taking questions at the end of our presentation today. There will also be a prize drawing at the end for those of you who were registered for the webinar prior to 10:15 this morning, and the winner must be present to win. I do have to let you all know that this project was supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services in Washington, D.C. Grantees undertaking projects under government sponsorship are encouraged to express freely their findings and conclusions. Points of view or opinions do not therefore necessarily represent official administration for community living policy. So before we jump in today, we just want to give you a little bit of history and information about the Senior Medicare Patrol program. SMPs are grant funded by the Administration for Community Living. Every state has an SMP program. In Georgia, Louisiana, and Mississippi, we're all sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and their caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education, much like we're doing today with our presentation. Now I'm going to go ahead and turn things over to Monique, who will get us started with this important information on genetic testing fraud.
Thank you, Sunny, and thank you all for joining us today. So let's dive right into our topic for today's webinar, genetic testing, fraud, and scams. So what is genetic testing? Well, the Center for Disease Control describes genetic testing as a series of tests that can provide information about a genetic condition or information about your potential risk to develop certain types of cancer. Genetic testing looks for changes or variants in your DNA. So there are many different kinds of genetic tests out there. So no single genetic test can detect all genetic conditions. And the tests are done by a cheek swab, blood sample, or spit sample. Next slide. So now that you have an idea of what genetic testing is, let's talk about the scams associated with genetic testing. Genetic testing scams are widespread and one of the biggest issues facing Medicare beneficiaries currently. The scammers are offering these tests for free to Medicare beneficiaries. So remember I said free. We will come back to that part. They ask the beneficiary for their Medicare number, tell them they are sending them a kit, and then Medicare gets billed for tests that are not medically necessary, tests that were never performed, or wasn't ordered by their physician. So that's the fraud piece. They fraudulently bill Medicare for these tests. And in some cases, they bill for a consultation with a telemedicine doctor. So these tests are not free. Medicare gets billed thousands of dollars for these tests, and sometimes the beneficiary can get billed as well. Next slide. Now, as you see here, genetic screenings go by many different names. Cancer screening, DNA screening, hereditary screening, dementia screening, Parkinson's screening, and pharmacogenomics. And that's basically, it tells you how well your body responds to medications. So I would say, looking at this list, we probably receive more calls regarding cancer and the DNA screenings than any of the other ones on the list. Next slide. So let's look at some examples of genetic testing fraud. So a company calling to offer you a test that you never requested, that your doctor never requested, and that you don't need. Another example would be Medicare getting billed for a test or screening that is not covered or doesn't even apply to you. And this last example is very common. So the company offering genetic testing sets up a table or booth at your local senior center, senior apartment complex, or even a health fair that you're attending. They sign everyone up for the testing, ask questions about their family or personal healthcare history, request their Medicare number, and then they bill Medicare. So you might be thinking, well, how is this fraud? Well, they are testing people that might not qualify for the test. Their doctor never requested the test. And in some cases, the beneficiary will probably never hear back from the company regarding their results. So Medicare ends up being billed for tests that didn't happen or for tests that did happen, but nobody got the results. So we receive a lot of calls regarding this situation where they went into an apartment complex or a senior center and they tested everybody. Some people heard back, some people did not. Let's go to the next slide. Now, one of the latest growing genetic testing fraud trends focuses on cardiovascular genetic testing. We are hearing reports of scammers calling Medicare beneficiaries claiming their cardiologist or provider wants them to have this test and offering to send them a kit. In reality, their provider did not make this request at all. They say this to get the beneficiary to consent to the test. Cardiovascular genetic testing fraud occurs when Medicare is billed for a cardiovascular genetic test or screening that was not medically necessary and or was not ordered by a beneficiary's treating physician. Now, there are several ways cardiovascular genetic testing is advertised. Cardio or cardiac genetic screening or test, cardiovascular genetic screening or test, comprehensive cardiovascular panel, comprehensive cardiomyopathy NSG, cardiovascular disease genetic kit, and hereditary cardiovascular profile. So those are some common terms that you should be on the lookout for. Next slide. All right, let's look at some examples of cardiovascular genetic testing scams and fraud. So, a company offering you a free or at no cost to you testing without a treating physician's order and then billing Medicare. Or a company using telemedicine to offer testing to you over the phone and arranging for an unrelated physician or teledoc to order the test. So this is a doctor that's not familiar with you or your healthcare at all. Billing Medicare, usually thousands of dollars, for a broad range of cardiac genetic tests that you did not request or possibly even receive. And lastly, a company calls you stating your doctor or cardiologist requested that you have the testing done, and then they will send you this kit in the mail. Now, to summarize our discussion on cardiovascular genetic testing fraud, let's take a moment and watch a short video of a beneficiary who was a victim of this type of scam. All right. Great video. What that beneficiary described in this video is exactly what we are hearing from other Medicare beneficiaries. All right, so let's move on. So we are going to now look at when genetic tests are covered. So they're covered when someone has stage 3 or 4 cancer, when it's medically reasonable and necessary, and federal regulations define necessity as services or items reasonable and necessary for the diagnosis or treatment of illness or injury, or to improve the functioning of a malformed body member. These tests are also covered when it's ordered by a treating physician, not a doctor that works for the lab or the genetic testing company, but your doctor. Federal regulations define a treating physician as the physician who furnishes a consultation or treats a beneficiary for a specific medical problem and who uses the results in the management of the beneficiary's specific medical problem. Tests not ordered by the physician who is the treating physician are not reasonable and necessary. These tests are covered when one or more coverage requirements are met for colorectal cancer genetic screening. So there is no other Medicare coverage for genetic testing as a screening service. And lastly, these tests are covered when a treating physician orders the test as a diagnostic service and uses the results to manage the patient's condition. Unfortunately, these things are not being met in all of the calls that we've received. These tests are not medically necessary. Someone's just calling them on the phone, offering this test, saying that Medicare requires it, saying that their physician requires it. So none of these things are met. So therefore, it actually should not happen. These beneficiaries should not be receiving these tests. Let's go to the next slide. So we talked about the criteria that must be met for genetic testing to be covered. So let's talk about what happens when the testing is not covered or the claim is denied by Medicare. So could the beneficiary be responsible for payment? Absolutely. Genetic tests billed to Medicare cost on an average between $9,000 and $11,000. If Medicare denies the claim, the beneficiary could be responsible for the entire cost. Remember, these types of tests should only be ordered by your personal healthcare provider who is familiar with your specific situation and will order tests that are medically necessary for you. Next slide. So here are a few things that you can do to help stop genetic testing fraud. So the best way to avoid becoming a victim of genetic testing fraud and scams is to be sure that your doctor has assessed your health condition. Although Medicare covers many genetic tests for diagnostic use, it only covers one preventative genetic test to screen for cancer. Do not give your personal information to strangers. In some cases, beneficiaries have reported that they did not give out their Medicare number, that the scammer already had it. So this is concerning, and we're trying to figure out how they have this information if the beneficiary didn't give this out to them. Next, review your Medicare summary notice, your explanation of benefits, and look for charges that mentions things like gene analysis, molecular pathology, laboratory. Those terms might indicate questionable genetic testing. Now, lastly, let us know if you see a strange or suspicious claim on your Medicare statements. It could be Medicare fraud, and that's definitely something that we could assess with. Next slide. All right, now that you are familiar with scams associated with genetic testing fraud, we're going to turn things over to Sunny, who's going to share the 3 keys to success in preventing fraud, errors, and abuse.
Thank you, Monique. So the first key that we want to talk about is protect. Protecting your personal information is actually your best defense against healthcare fraud and abuse. You should always treat your Medicare and Social Security numbers like you would your credit card. Never give these numbers out to a stranger. You want to remember that Medicare does not call and ask for your Medicare number. They don't call and ask anyone to verify information that they already have on file for you. Don't carry your Medicare card unless you really need it for a doctor's appointment. It's best to just leave it at home. And finally, you want to keep a record of your medical visits, tests and procedures. The great way to do that is to use a calendar or healthcare journal. You'll want to write down the dates of service, the provider that you saw that day, and if you had any, what types of procedures or lab work did they do that day? This will come in handy for the second key, which is detect. So knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. It's very important to review your Medicare summary notice, which is called an MSN, or your explanation of benefits, sometimes called an EOB, from your insurance company. Your Medicare summary notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you'll receive an explanation of benefits after you receive healthcare services. Now, here's where the calendar or personal healthcare journal come in handy. You want to compare your statements to your personal records and look for the following items. You want to look for charges for something that you didn't get, billing for the same services or supplies twice, and you also want to look for services that were never ordered by your doctor but billed to Medicare. And by using a calendar or journal, you're easily able to verify the dates of service and other claim related information that would be important to look at on your Medicare summary notice or your explanation of benefits. The third and final key is report. So if you suspect that you have been the target of fraud, you want to report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious phone call, don't give out any personal information. You want to report that call immediately to SMP. If you have questions about your Medicare statements, you should call your healthcare provider or your plan. Now, if you're not comfortable calling your provider or you're not satisfied with the response that they gave you when you did call, you can call Senior Medicare Patrol. We can work with you to identify issues. We can work with your provider and Medicare to get those issues resolved. We are a federal reporting agency, so if we do determine that there is a potential fraud issue, we refer this information and the complaint off to the Office of Inspector General, and they take it over from there. So now that you've heard the 3 keys to success in preventing Medicare fraud, you might be wondering how you can help and become involved. Well, SMP is always looking for active aging adults to join our fight against Medicare fraud. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers also participate in bi-monthly webinars and various training opportunities throughout the year. So if you think that volunteering for SMP is something that you might be interested in, give us a call at our toll-free number, which is 877-272-8720. We would be more than happy to send you one of our volunteer information packets and answer any questions that you might have about the process. So as I mentioned in the previous slides, we do have a toll-free hotline number that is answered by a live person, by the way, during business hours. You can also visit our website, www.stopmedicarefraud.org, for additional information about our program. And we would encourage all of you to like us on our Facebook pages. And keep in mind that next month, we'll have our Webinar Wednesdays event on May 25th at 10:30 a.m. And we will be meeting to discuss the latest in ambulance services and fraud. We'll be sending out an invitation to join us for that Webinar Wednesdays event soon. And we hope that you'll join us then. All right, so before we wrap up today and open the floor to your questions, we're going to go ahead and do that prize drawing for those of you who joined today. As I mentioned earlier, those who were registered to attend this event prior to 10:15 a.m., you all have been entered for a chance to win. Let's see, here we go. And good luck. Let's see who's going to win our prize today. So Miss Guinevere C, let me just take a look real quick and see if she is on the call. Miss Guinevere, if you're
Mhm.
here with
Oh,
us. You
I'm
see her
not.
name, Monique?
No, I don't see her name on it.
No.
Mm-mm.
Okay. All right. You do have to be present to win, so we're going to remove her name and try one more time. Teresa H.
We have a
Yep,
Teresa Huggins.
we do. That's Miss Teresa. So congratulations, Miss Teresa Huggins. I will be reaching out to you later to get some information so we can get you your prize. All right, and just give me 1 second to get back to um, my PowerPoint presentation. There we go. Let's see. All right. Before we wrap up today's presentation, we're going to go ahead and open the floor for questions. So if you have a question, you can raise your hand and we will unmute your line and you can ask your question. If you look to the right of your screen, you'll see a control panel that has a hand icon. And if you click on that hand icon, it's going to raise your hand for us. And that way, we'll unmute you. You're probably going to be muted yourself, so you'll have to unmute your line as well. But please feel free, if anybody has any questions about the material that we presented today, go ahead and raise that hand and we'll open the floor to you for your question. Okay, let's see. I see a hand raised. Miss Christie, I've unmuted your line. Did you have a question?
No, I just wanted to say, on behalf of all of our seniors, especially with the Auction or Golden Opportunity Program, thank you so much for always having valuable information available for us. And you're such a great resource, and we appreciate all you do.
Oh, thank you,
Oh,
Christy. I
thank
appreciate
you.
that. We enjoy partnering with you guys as well. Okay, let's see. Do we have any other questions? Oh, we did have a comment. Thank you so much for providing the video. It was helpful and informative. Good. All right. Well, I don't see any other questions or comments. This will conclude our presentation today on genetic testing, fraud, and scams. We will send out an email later today with the link to a short survey. We would really appreciate it if you would complete that survey to let the Administration for Community Living know how we did with today's presentation. I've also included it in the chat in case you wanted to click on that in the chat and go ahead and start it now. But we really appreciate you all joining, and we really hope to see you again soon. So everyone take care, and we will talk to you again next month. And thank you, Monique, for that great information on genetic testing.
No problem.